For the anterior deltoid ligament, for this test, I'm going to be on the lateral aspect of the patient. I'm going to allow the foot and ankle to drop into mid-plantar flexion. I'm going to grasp the distal tib fib and the talus and navicular. I'm going to take up the slack in the ankle. I'm going to distract it out of the mortise. And I'm going to apply a abduction force to the movement. And that will, there shouldn't be much movement there. And a positive test would be extra laxity in the anterior deltoid ligament.
The ligamentous test for the anterior talofibular ligament. So you are on the medial side of the patient and you want to allow the foot to relax. You grab the distal tibia and fibula with one hand and the proximal talus with the other. You apply slight adduction force and then distraction to try to pull the talus out of the mortise. And a positive test would be if you get a lot of motion. Normally, you shouldn't get much, even if you pull hard. Ligamentous test for the calcaneofibular ligament. And so you want to directly face the patient's foot and cradle it with one hand, dorsiflex the foot and ankle to neutral, and then you want to invert the calcaneus maximally, and a positive test would be if you get a lot of motion. Normally there shouldn't be much.
I'm going to be down, again on the lateral aspect, but slightly facing the patient. I'm going to cradle the foot. I'm going to bring it into dorsiflexion, into neutral, and then I'm going to grasp the distal tib fib as well as the calcaneus. I'm going to take up the slack and I'm going to evert the calcaneus. And that's testing the middle deltoid ligament. If there's extra laxity there, it could indicate a tear. Last test is the posterior deltoid ligament. I'm going to be on the lateral aspect of the patient. I'm going to dorsiflex the foot and ankle. I'm going to grasp the distal tib fib, and while I'm doing this, I'm going to dorsiflex and I'm going to twist the foot internal in a pure rotary fashion, and that's testing the posterior deltoid ligament, and extra laxity would be a positive test.
Test for the posterior talofibular ligament. So you want to be on the lateral side of the patient, and you grab the distal tibia and fibula again, and the calcaneus, dorsiflex past neutral, and then twist in an external rotary motion. And same as the other ones, a positive test would be if you get a lot of motion, where normally you wouldn't get much.